Hello, Dr. As I promise we'll keep the learning even if I'm not around. So the first things what the topics today that I want to talk about is the isolated rise of alkaline phosphatase, as I promised in my short videos from before. So let's crack on. Okay, so what I mean by isolated rise of alkaline phosphatase, what I mean by isolated rise of alkaline phosphatase, that if you did a blood test for a patient and you find that the bilirubin, okay, and the liver function, the bilirubin is normal, and the transaminases is normal, including ALT and AST. Please be careful that AST in some dinners is not part of the liver function, so you might need to order it in a separate request. And the calcium and vitamin D or the calcium are normal. Okay, so that entity called an isolated rise of alkaline phosphatase. Okay, including normal calcium. So that will make you think in two major pathways. Okay, is it a physiological rise of alkaline phosphatase, or it is a pathological rise of alkaline phosphatase? So physiological rise, that usually will find it in pregnancy. Okay, because the one of the placental hormones is the alkaline phosphatase, especially in the in the third trimester, you will find that the alkaline phosphatase is high up in the sky, and in the children because they are growing. Okay, and you know that alkaline phosphatase is one of the important chemical mediator in bone metabolism. Okay, so that's if you find it in the children, that's considered to be normal. Okay, provided that the patient doesn't have symptoms. And then analytical or statistical anomalies, and we'll come that and we'll explain it on details because it's a very important concept in medicine. And then what are the pathological? As I said, three main categories. Is it liver? Is it bone? Is it metastasis? So liver, is it cholestasis? And then we'll find the GGT is high in this instance. And then primary biliary cirrhosis, and you will find that an anti-mitochondrial antibody is high at that instance. And in a liver lesion, then the ultrasound will guide you in that case situation. Bone-wise, if the patient have fracture, that's normal. The bone metabolism is high. Bone is trying to heal itself, and the alkaline phosphatase with high. Osteomyelitis, again, inflammation in the bone, and that will cause the alkaline phosphatase to become high. And what is very common and important is vitamin D deficiency, osteomalacia, or even rickets. Okay. Uh, Other disease is called Paget disease, and we will have another lecture regarding vitamin D deficiency, hypervitaminosis A, D, and Paget disease soon. Will be I will post it in my channel soon, and then metastasis cancer. Okay, so either prostate cancer, the ovarian cancer, or any type of invasion of the bones. So be aware about that. Okay, be aware about some cases that can have abdominal aortic aneurysm, and then the abdominal aorta is creeping in the bone, causing erosion in the bone, and then they will come with the low back pain and the high alkaline phosphatase. That's one of the cases that I met in my in the emergency department. Okay, keeping in mind that alkaline phosphatase will be high if the patient have chronic or acute kidney disease, because you know the kidney is the source of filtrate or excretion of the alkaline phosphatase. So if the kidney function is high, it's very difficult to interpret the alkaline phosphatase without having trends. Okay, trends of the alkaline phosphatase. Also, if you have problem in the thyroid, that will cause high alkaline phosphatase, either hyperthyroidism, hypothyroidism, or goiter. Okay? Coming back to the medical concept, it's very important medical concept in medicine called analytical or statistical anomalies. And that will lead us on thinking how we are putting the normal range of a lab test. Okay, so we are bringing the scientist will bring the population and will take different blood samples randomly from the population and then plot it on the pill curve, and then the median or the middle 95% of this reading will be the normal, okay, which is from this area to this area, will be the normal range. Okay, and then the extremes, either the lower 2.5% or the higher 2.5%, will be considered abnormal. Okay, and that will lead us to a concept. So extremes of reading, okay, out of range reading cannot be considered an abnormal or diseased, except if you correlate that with the clinical vignette. For instance, a lot of patients will come and, query having muscular chest pain in the emergency department or even in the AD or even in the GP. And then once you make the troponin, you'll find the troponin very high, but the patient doesn't have a clinically significant cardiac related uh, chest pain. Repeating the troponin, you will find it the same. Repeat the troponin, you find it the same. So it's not increasing. The trend is stationary. So these patients, their baseline troponin is high, as well as in any other, lab tests. You might find the patient having a high alkaline phosphatase. When you repeat it, it's the same. When you repeat it, it's the same, and the trend is stationary at that high level, as well as you have no symptoms. So that's called the statistical anomaly. Okay, this doesn't mean that the patient is diseased. That doesn't mean the patient have a pathology, but it's just outside of the common normal range, the 95% of the pill curve. Okay, one important thing that I need to emphasize, please, 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 don't presume because the patient have low vitamin D and high alkaline phosphatase, the deficiency is the vitamin D is the cause of the high alkaline phosphatase, because you need to, to correlate that to the medical vignette, to the clinical vignette, because still there may be hidden pathology behind that. Okay, so you need to correct, correct vitamin D, follow up the patient, and also, analyze his symptoms or symptomatology of the patient. And here's what I said: the isolated rise of phosphatase with normal bilirubin is there, when aminotransferases are normal and the calcium are normal. Coming to a very simple, easy mind mapping algorithm and how to approach a patient with high alkaline phosphatase. I strongly advise each one of you try to take a photo screen of that algorithm, print it, and keep it in your a desktop, because I presume you will need it when you start to become as an independent GP. You will find a lot of people have with isotyl phosphatase, and that will keep you busy. Okay, what should I do next? What I should do? And do I need to investigate or not? But that algorithm make the things very easier. Okay. So first, you need to see if the patient is symptomatic or not. Or does the patient have a bone pain or back pain? Okay, so either there's a bone pathology, there's multiple myeloma, or not, and then if there's and then does the patient have abdominal pain, there's any intestinal pathology, any problem in the liver that can present with this high alkaline phosphatase, because also some cancers in the gut can cause high alkaline phosphatase due to secondary metastasis in the liver, and then if the patient having a weight loss or not, and then coming to the renal failure, because the clearance of the alkaline phosphatase coming from the kidneys, and then lastly, if the patient have symptoms of heart failure. Why? Because the heart is there, the liver is there, and then when you have left-sided heart failure or even right-sided heart failure or cardiopulmonary, you will have back pressure of the blood. Okay, and that will make liver congestion, and the congestion of the liver will cause high alkaline phosphate, but usually is not only alkaline phosphatase, you will have the transaminases and the GGT elevated as well. Okay, so then what is the next step? The next step, if the patient is symptomatic, we will treat accordingly. Okay, if the patient is symptomatic, as we usually do in the GP land, we need to repeat the blood test to see the trends of the blood. Okay, repeat it within 4 weeks, and then at that time, within the repeat blood test, you need to make your differential. Okay, what is there is a pathology happening there, and so the GGT. Okay, to see if there's a stasis node, UNEs to say renal failure, full blood count, see if there's any anemia, any problem with microcytosis, which could give you a hint as well if there's a cancer happening around or not, and then the calcium level, as we already approved, calcium level, vitamin D, and the thyroid function test, because the thyroid function, and as we said, any disease in the thyroid will cause high alkaline phosphatase, and that will lead us to two main categories. If the GGT is high, that's give us a sure sign that it might be a liver. If the GGT is normal, then mean that there is problem in the bone pathology. Liver-wise, we'll do then ultrasound to make sure that there is no structural deformity in the liver, structural anomaly, and then anti-mitochondrial antibiotics to exclude primary cirrhosis, and then you would refer according to the results. Okay, if the GGT is normal, you need to check your vitamin D, and then consider bone scan to exclude any pathological fracture, any metastases, or any multiple myeloma, and then manage accordingly. However, then if the patient, all of these investigation ended to be normal, okay, if the rise in the alkaline phosphatase is less than 1.5 times of the upper limit, you need to repeat the alkaline phosphatase every 6 months and see the trends. If the trend is stationary, then you can reassure the patient and tell him, this is your normal, you are statistical anomalies, and this is your baseline. No need to worry about that. However, if the alkaline phosphatase is more than 1.5 the upper limit at any time, then you will consider referring him to the hepatology consultant for probable, biopsy to just execute early primary biliary cirrhosis. Coming back still, okay, it's normal. It's in 1.5 or more than 1.5, and still you don't know what is the cause, where to go from. There is a very expensive test called alkaline phosphatase isoenzyme, is done only in the King's College. So please, if you are ordering such investigation, and make sure that the patient indicated for it, because expensive, done only in one hospital in the UK, as well as the roundabout time is around 6 weeks. Okay, so the enzyme, we have four enzymes: placental, intestinal, bone, and the liver. Okay, and then before if usually according to the guidance, usually high alkaline phosphatase, you will be able to discriminate the cause of the alkaline phosphatase just with the clinical vignette. However, if you need to do the blood test before doing it, the needed to prerequisite vitamin D, the normal investigation, vitamin D, GGT, and liver function test. The tube that either the yellow top tube or the golden top tube, okay? And then the roundabout time is 5 weeks, and it's only in the King's College. I hope that is useful, doctor. I hope that makes better understanding of isolated rise of alkaline phosphatase. Just a small hint, please don't consider the statin as a cause or isolated cause of alkaline phosphatase. If a statin will cause liver injury, usually will increase the transaminases, will increase the alkaline phosphatase plus or minus GGT. Okay, however, there's very rare cases or two cases reported in UK that the statin was accused for increased alkaline phosphatase isolatedly, but with a certain combination of other drug like nifedipine and calcium channel blockers. So in general, please don't consider statin as a cause of raise of the alkaline phosphatase. It will be very helpful for you. Please, if you can encourage me and follow me in the my YouTube channel. Okay, it's a Level Up channel. Please like, subscribe, and share. Okay, share the knowledge. Share the good work, as I believe, and also you might consider joining me in my Telegram group, a WhatsApp group, and this is the link. Okay, if you need any further help, you can call me on my phone number. Okay, I'm doing one-to-one coaching, okay, either mini mocks for the essay exam or even teaching on hourly basis to take you through the stepwise approach of how to go through the case in a step fashion, and make the break through the cases very easily with different type and structure of the presumed cases in the exam. I hope all of you find my YouTube channel helpful, and I hope all of you find my teaching helpful, and I'm very happy to have any comments in the comments section below the video, okay, for any further improvement or any topics you would like me to talk about. Thank you, and I hope I will see you soon.